Good evening, everyone. Thank you all for joining. This is the April edition of our Careers Close-Up. So this is a monthly webinar that we do. It's completely free, just to provide insight about different careers within healthcare, so that you guys can all learn from someone that's been somewhere that hopefully you want to be. And it's usually very, very helpful, really productive. Please feel free to write down lots of questions. You can pop them in the chat and Gloria will answer them all at the end of the session. And remember that we're also streaming live on YouTube. So if you would like to join on YouTube for any reason or share the link with your friends, they can also join on YouTube. So I'm just going to welcome Dr. Gloria. Thank you so much for joining us. I've got her bio here. Dr. Gloria Kwanzaa is a junior clinical fellow currently working in an NHS trust in London in their F3 programme. She's a Ghanaian trained medic, enabling her MBCHB degree from KNAS in 2019. She gained entry to the UK register through the PLAB route and started her first post in August 2023. Her current role has allowed her to rotate through a variety of clinical posts, including ENT, major trauma, intensive care, and haematology, where she has gained experience and also participated in some clinical audits and research opportunities. Gloria is also keen about teaching and has been involved in mock exams.
Thank you so much, Dr. Emma. Good evening, everyone. It's great to be here this evening, and thank you all for joining in. I hope you can hear me fine. Just let me know if at any point it cuts out or anything happens. So as Dr. Emma said, I'm just going to be sharing my journey and just coming to the UK and, any tips and advice that I have for anyone listening. Before I share my presentation or actually start, if you could just comment where you're from, like what country you're from, and if you have started the UK kind of process and where you are, like have you already finished your plabs? Are you looking for a job? Like it would just give me a better idea of where everyone is and know where to kind of focus more on. So you just spend like a few seconds, 1 minute, just comment. That would be great. Don't be shy. Mm. Thanks in Ghana, prepping for my I'm from Ghana. I'm currently looking for a job. All right, that's very helpful. Thank you guys for sharing. I will just start sharing my slides now. Um, are you able to see my slide? Very small. Yeah, I think that might be because I don't think I can increase it actually. Um, Sorry, Dr. Emma, is that possible to share from your end? Okay, I'll just stop sharing for now. I'll just start talking in the meantime. Because the beginning is just about myself. Really not much to add from the bio. So I had my medical degree in Ghana, so 6-year degree in the Kwame Nkrumah University of Science and Technology in Kumasi. Following that, I did a 2-year housemanship. So in Ghana, you have to do 2 years. I think most of us are from Ghana here, so we already know this. So I did my 2 years in Accra, and then after that, so it was in the middle of housemanship that I actually started to kind of work on the UK and work on my clubs and things like that. And so I finished housemanship in 2021, and then in 2022, 2023, 20, ending of 2022, I had my license to practice in the UK. And then in 2023, I moved to the UK and I've been here since August of 2023. So yeah, that's about me. So in terms of the journey, so I went through the PLAB route, as Dr. Emma said. The first thing was the IELTS, then I did my PLAB 1, my PLAB 2, then did my GMC registration and then job hunting. So this is going to sort of be the framework that we're going to be speaking about today. And I'll just share my experience and also share the tips that I have for sort of each of these stages. Next slide, please. So the first thing was the IELTS, and as most of us know, most countries, if you've had your university degree in certain countries, you have to prove your English proficiency to the General Medical Council before you can even take the exam, and it will also help you later down the line in your registration. So unfortunately, Ghana, sadly, even though we speak a lot of English, was part of the countries. So I took my IELTS, and I think with regards to IELTS, the main thing that I would say helped for me personally was this website called IELTSonlinetest.com. So the IELTS test 4 domains. So there's the speaking, there's the listening domain, there's the writing, and then there's the reading. So each of these domains, you need to score at least a band of 7. So the IELTS, they grade it in bands. So the highest you can get is a 9, I believe. But you need to get a minimum of 7, and your average overall has to be 7.5. It's really important to practice as much as possible before you take the exam. I find that the practicing just helps you to be more comfortable with the style of questions that they ask, because it's a time-bound exam and you don't actually have, especially when it comes to the reading and then the writing and even the listening section as well. You don't really have a lot of time on your hands. So you need to know sort of how they tend to ask their questions so that you're kind of ready to go. So that website, IELTSonlinetest.com, had a lot of just like mock exams and different tests that you could just take for free, and it helped a lot. The other thing that helped was some YouTube channels. So there are quite a lot of channels that do like IELTS content, but the ones that I found to be quite helpful was the Fast Track IELTS, IELTS List, and then E2 IELTS. So this helped more when it came to the speaking portion, because they gave tips on how to answer the questions, and just not answer your questions with a yes no. You have to kind of elaborate more on your answers. So it was quite helpful. They had like practice sessions and things like that where you could see them with someone else conversing, and then what they'd expect from the exam. So that's the tips that I would give when it comes to the IELTS exam. It's one of the things that can sometimes be very annoying, because it can be a barrier where sometimes you get 6.5 and then now you need to retake it all over again. And it's an expensive test as well. So as much as you can, just try to prepare for it and hope for the next slide. So once I passed my IELTS, I was able to book for the Club One exam. So with the way it works, without your IELTS, you cannot even book for the Club One on the GMC website. So the Club One, I actually failed Club One the first time I took it. So yeah, that was rough. So I used the Clappable resource. So that was the only one that I used both times. But the difference was the first time I actually didn't really finish the content. Whereas the second time I went through like maybe 90% of Clappable. I personally found Clappable to be quite helpful. I think my tip with Clappable is to read the um, notes that they put under the different questions, because then that helps you to solve any question that comes in that topic. So it's not just about solving the questions, but actually also trying to understand a bit behind some of the concepts that come in the questions. So for me, I think that's what helped. Most people recommend doing Flappable at least 2 times before taking the exam. I didn't do it twice. I did it once, but I feel like I did it really well once, and that helped. So just take your time, try to do as many questions, try to finish it completely. If you can do it twice, amazing, you probably will ace it completely. But if you can do it only once, I think that my tip would be to actually read the notes that is put under. And also there's this like gems that they have, which is like flashcards and like salient information that you must know. And I found that very helpful in the few weeks leading to the exam, or not even weeks, more like the few days leading to the exam. Um, so yeah, that was my Tab 1 experience. The Tab 1 is usually 180 questions, and it's a multiple choice exam, and it basically covers a host of different parts of medicine. So you have your anatomy, a bit of anatomy, a bit of physiology, a bit of pharmacology, and then you also have the specialties itself. So ophthalmology, medicine, surgery, basically a mix and match of every single thing you can think of comes in your Club One. So yeah, that's it. And the next one. Club two. So I took once I passed my Club one, I was able to book my Club two exam. And with Club two, it is, so unlike Club one, which is multiple choice and like a theoretical exam where you actually um write and choose the answers. With Club two is more of a practical exam, so it's OSCE type, and there are different stations. And most of us have had that kind of experience during medical school. So it's similar experience where you go to a station, there's a patient, there's an examiner, the patient might have a complaint, or you might need to do a particular exam on them. There's certain stations where there's a procedure to do. So there are different things that you can get in your Club two exam. If they haven't changed it, as when I did it was 18 stations, and it was a really long, but at the same time fast exam, very nerve-wracking. But I think that when it comes to Tab 2, the most important advice I can give is to practice, practice, practice. It actually really, really helps a lot. And you want to give yourself enough time to really go through all of the different scenarios and stations that you can possibly get in your exam. So for my Club 2 prep, I actually had a study group, and we basically used to meet every night and we'll just practice on each other. I found it very helpful. That's the one tip and one advice that I'll give in one preparing for their Club 2. Club 1, you can sort of do it in isolation. Even with Club 1, it's helpful to have a study group. Because of the nature of the exam, if you sit down by yourself and you study, you probably will be fine. But I think when it comes to Club 2, you need to at least find one or two people and just be able to practice with them. There are different academies that exist that you can register with and start with. The only con is that they are very pricey and they are quite expensive. In my experience, I did find the academy that they organized in the sense that they did have a lot of the mannequins and the stations where there's certain procedures and things. So I found it helpful to sort of be able to practice when I came to Manchester to take the exam. But and then the fact that they had the mock, exams that they did, had three mock exams in total. And by the time I finished the third one, I felt more ready and for the exam. So that's what I found helpful. But in terms of the teaching and the material, I feel like you can study the material, you can find it. Uh, that's where the academies become very helpful when it comes to sort of being able to practice, being able to use the mannequins, and then they are pricey. So just consider that before you, because uh, what you can do regardless of academy is just to practice with each other. When it comes to the scoring system, based on sort of data gathering skills, and you have your management plan to how able to manage, the patient or the disease. And then the final domain is the personal skills. And all of the different, domains have the same number of marks. My biggest tip is do not sleep on your ideas. Do not sleep at all. It's very, very, very. If you are able to score very well in personal skills, and you can, regardless patient is you can score, they automatically score to give chances. Data gathering, because data gathering is about building a history into our most of us don't taking these histories should be able to do the secretive. Can you hear me now? So I was saying that the main tip that I would give when it comes to the PLAB2 is focusing on your interpersonal skills, because you can easily get the full marks in there. And then once you add that to your data gathering, even if you, because I think what most of us tend to be scared about is, what if I don't know what the diagnosis is? What if I have no clue and no idea what, the disease is, like what was my diagnosis? And I actually did have one of my stations during my exam where I genuinely had no idea. Like I knew that what I thought the diagnosis was wasn't the actual diagnosis. Like I knew that for a certain. But I knew that even if I didn't know what the diagnosis was, so far as I've been able to take a decent history, I've been able to rule out red flags. So red flags are really important. If you've got a lower limb swelling, you know that your red flags you have to rule out, it's something like a DVT. So, you want to make sure that you're asking questions, in that regarding complications of a DVT, like a PE. So whatever the symptoms, whatever the patient is presenting with, you just want to make sure that you're doing a good enough history and your interpersonal skills. So you're smiling with the patient. Patient says they're in pain. You're not ignoring the pain. You're asking, how bad is the pain? Do you want some pain relief before we continue this conversation? You want to show empathy. If someone says, my dad passed away, you're doing a family history and they say that my dad passed away 2 years from an MI, or my mom passed away 1 year ago from breast cancer. You don't just want to glide over, this information that they've given you. You don't need to spend 1 minute, saying I'm sorry that happened to you and going over it, but at least just take a few seconds to say, oh, I'm really sorry about that. And that alone shows that, okay, because what they're looking for is doctors who not only know their medicine and their science, but doctors who, are able to display compassion and empathy. And these are the values that they're looking for. So that's my number one tip when it comes to passing, PLAB2 and passing it really easily. And then, yeah, next slide. So once you've successfully passed your, oh no, before I move on to this, I actually wanted to speak about what to expect on the day. So the Part 2 exam is in Manchester in the UK, so that's the only place you can take the exam in the UK, so you have to come in person. On the day of the exam, before the day, usually there are two batches. So there's usually a morning batch and then there's an afternoon batch. So before the exam, like a few weeks before the exam, or yeah, you know exactly which batch you are going to be at. And there's also two sites. This is a really, really, really important thing. Make sure that you know which particular one you're going to, because there's Hardman Street and there's Hardman Square, and both of them are not too far from each other. But the last thing that you want to do on your exam day is to arrive and then you find out that you're actually at the wrong place, and then those little things like that can really throw you off on a day when you're already feeling sort of nervous. So just make sure that you read that email well, the exact site you're going to, the exact time that you're meant to show up, and whatever instructions you're given, whatever they ask you to bring along. If usually they'll ask you to bring some form of ID like your passport, so make sure that you bring all of those things, because it's things like leaving your ID at home. That's what will stress you out when you're there and can throw you off your game. And then once you arrive there, once it's time to come in, they'll usher you in, and then they give us sort of give you like a brief talk and a brief um, overview of what to expect. And then once it's time to actually start, like Oski style, everyone would be in front of a particular station. Maybe if there are rest stops in between. I think there are two rest stops in total. So if you're at a rest stop, then you're at a rest stop. And then the bell rings and then you start. So that's the main thing to expect. Just wanted to highlight that. Next slide. Thank you. So then you've passed your PLAB 1, you passed your PLAB 2, the hard work is over, but there's still more work to be done, which is your GMC registration. So when it comes to your GMC registration, I'd say just try to do it like the earlier the better. Usually you need some form of ID, so your passport, you need your MBCHB or MBBS certificate. You also will need a certificate of good standing from your medical council, your local medical council, wherever you're coming from. You also will need a valid IELTS report form. I'm not too sure whether it's 1 year or 2 years. I'm sorry, I have to confirm that, but you do need your IELTS again for the registration itself. And then usually they would ask for some sort of proof of your employment history and the places that you worked at prior to up until the time that you're applying. And that usually comes under, if you have a certificate of completion or something like an internship or housemanship after medical school, then that's really helpful and that sums up your employment history really well. So that's what I used in my case. So these are the main documents I remember needing for the GMC registration. And then there's a fee to pay. Usually the fee is dependent on how many years that you've been, out of medical school. So the longer it is, the higher it is. But I know sometimes there's like a discount. So definitely make sure that you find out whether there's a discount before you pay. Usually there is sometimes a discount. So once you have all of these documents and you do your registration, they'll let you know. It takes a while, a few weeks, sometimes not too long. Actually, in my case, I don't think I waited too long. And then they'll let you know if there are any other documents that they need. They usually are quite good at telling you, okay, we need this or this isn't clear. Can you clarify this? But if everything's fine, they will let you know that congratulations, you are now in the UK register, and ta-da, that's it. Next slide, please. So once you finish your all of this and all these hurdles, it feels like, yeah, you're done. But then there's another phase called, which a lot of us start to term the plug 3, because it genuinely felt like an exam on its own, which is the job search. And I put this meme there because it really felt like the Hunger Games. And I applied. So I started job hunting in December of, well, I didn't start, I got my license in December of 2022, but I officially started looking for jobs seriously in January of 2023. And I got my job, the job offer, in June of 2023. So it took me 5 months to get this job. And this was 2 years ago. And I know that within the like these last 2 years, it's gotten even worse. Like, I'm sure all of us here have probably heard, and the competition ratios and the jobs, because I've been on track lately myself. And I've just seen how very few jobs, compared to when I do the comparison compared to 2 years ago, I feel like there's just generally fewer jobs than before. But there are still a few jobs, and people are still getting offers here and there. So I'm still going to share, the tips and things that I found helpful during my job search. In terms of jobs, you have broadly, you have the NHS, which is the National Health Service. So that's the government sector, quote unquote. And then you have the private. Under the private, there are different groups. The very popular ones are the NES. I think there's the RMO as well. And these two, so you can have the NHS job, which you would, apply to directly through the NHS. But even under the private sector, I know people who are employed by, a private agency. However, they are working for the NHS. So their actual day-to-day job is in the NHS. However, their employer is private, so they are paid by a private employer. But then the private people also have private hospitals where you can work at. So it really depends on what, the agency decides, and basically the negotiation that you have with them as well. And then in the NHS, you have training jobs versus non-training jobs. So the training jobs, a residency job, so you know that, okay, this is the specialty I'm doing. It's for X amount of years, and you have a clear timeline of what you're doing, and an expected end of, okay, I'm doing GP training. It's for 3 years. So after 3 years, I'm going to be a consultant GP, or I'm going to do core surgical training for 2 years, and after that, I have to apply for higher surgical training. But that all still exists within the NHS. And then you have the non-training jobs. So I feel like the best way to explain the non-training jobs, if you're from Ghana, it's like you're a medical officer, so it's like an MO job. But even with the non-training jobs, you can have different grades of non-training jobs. So you can have the more like junior clinical fellow jobs, which is what I'm doing at the moment. And you can have senior clinical fellow jobs, which are still non-training. All of the different jobs that you can apply to, it really depends on your experience, your skills, your expertise, and how well you're able to sell yourself, to be honest. With how competitive things are these days, you really need to have a lot more to offer than just your degree and the fact that you've passed your PLAB exams, because everyone that's applying with you has done that. Everyone applying with you has finished medical school. Everyone applying with you has passed their PLAB. So it's like, what separates you from the next person? What have you done more than the next person? Why should we take you, or why should we give you the job? And so when it comes to supporting information, so when it comes to NHS jobs, and it comes to the non-training jobs specifically, there's the website called apps.track.jobs. Or even if you just Google NHS jobs, it will send you to the website where they put different NHS jobs. It's not even just medical jobs, nursing, different jobs, but you can find the medical jobs on that website. And there are actually filters that you can use, which is really helpful. So if there's a particular specialty that you're interested in, so let's say maybe you want to do internal medicine, or you want a job in emergency medicine, you can put those filters there. You can also put a filter of the grade of job that you're looking for, and then it will show you the available jobs to apply towards. And when you do a job application, usually they will ask for your biodata, so the regular things like name, age, date of birth, all those things. And then the next bit that they tend to ask for is your employment history. So they'll ask you what your current job is, where it is, the location, country, all of that. And then they'll also ask for a brief description of your roles and responsibilities. So it's important to, put down everything that you do in that particular job, because that gives them an idea of your expertise. And then apart from your employment history, then that next bit usually tends to be your supporting information. Different trusts and different jobs have different ways of putting it, but at the end of the day, most of them will be asking about audits. Most of them were asking about teaching, leadership, quality improvement projects, skills, procedures, and teamwork experience. And I'll just speak briefly on some of them that we don't tend to do a lot sometimes from where we're coming from. So when it comes to audit is basically there's a set target or there's a set standard, and you are auditing the practice of the people versus the set standard. So it can be something as simple as maybe in your emergency department where you work, any patient coming in needs to have their blood pressure checked within 10 minutes, right? Your audit can be to, check, are people actually doing this? Are people actually complying with the standard that we've set for ourselves? So you go through maybe 50 patients in the last 2 months, and then you see, okay, this person came in at 9:05, they got their BP checked at 9:20. So they got their BP checked in 15 minutes. And then you compare, okay, maybe 20 people were able to get their BP checked in time, 25 people weren't. And then you can break it down even more. There's so many things that you can do with that data, but it is simply put, it is looking at a set standard, a set rule, and comparing the actual practice on the ground with that set rule. And then once you do your audit and you have your findings, usually it's helpful to be able to present it in a departmental meeting wherever you find yourself, and then you can do like flyers and posters, or just spread the word. Okay, guys, we're not doing well. Out of the 50 people, only 10 people were able to do in time. So what can we do to improve our numbers or improve our practices? And then once you've done that, after a while, you can re-audit again and see if there's been an improvement in the practices. So the reason why I'm just sharing all of this is because audits are one of the things that, even when maybe you get an interview, they might ask you, oh, have you done an audit before? And it's really helpful if you've done one and you can share your experience about it. So it really doesn't matter where you find yourself. Trust me, there's something that you can audit in whatever department it is. It doesn't have to be anything too fancy or too complicated. It can be the most simple things. Think about antibiotics practice. Just think about anything that's meant to be a standard and just audit the actual practice. It doesn't have to be a large number as well. 50 is a good number. You don't need to do, I'm not saying that don't do a lot of work if you want to, but I'm just saying you don't have to think that it has to be this big thing. Just especially for your first audit, just try and just start small, and it'll be really helpful to have on your application and on your CV. The other bit is teaching. So I know most of us will definitely be involved in teaching wherever we find ourselves. There's always medical students usually rotating around, nursing students, PAs sometimes. So just one thing I'll say with teaching is that it's important to get actual feedback. So whenever you do a teaching session, you can just create a Google form or create some type of feedback form and get the people that you taught to actually give you feedback, and then just keep some of these things because it's helpful in the long run. And then take up any leadership positions where you're the head of your house officers. And some of these things, you may have done it, but you might forget. When you are starting your application, just think about everything that you've done, ever done, and write it there. Even leadership positions that you've had in medical school, just think about anything that you've done. Don't be afraid to tell yourself at all. The other thing is quality improvement projects. So these differ slightly from audits. So with quality improvement projects, you're looking at what can I do to improve the experience of patient care and to basically improve the quality of patient care. So it could be, something about waiting times. Maybe you realize that patients who, come for a certain clinic are waiting too long because there's only one, temperature probe or something. So you decide to, um, address it, speak with bosses and things like that to try and increase that number. And by that, you reduce the waiting time in the clinic. And that's improve the quality of the service that you're providing. So anything that improves the quality of service you're providing is a quality improvement project. And then the other bit is your skills. So what skills can you do? Usually there's a portion where you have to put in, what procedures have you done, like IV cannulation, catheterization, anything that you've done, just make sure that you're documenting it. And yeah, there's also like teamwork experience. So have you worked in a team before? And just the more that you've done, the more that you can put on the application, the better it is. Next, please. So next bit is the interview. So you've done your applications and you've been able to get an interview. That's really great, but you need to prepare for your interview. In my experience, I had 2 interviews. The first one, I didn't get the job. The second one is the one that I got the job. I say prepare as much as you can. So have your gadgets not misbehaving. Say my laptop is misbehaving. If this was an interview, I'm in trouble. But you really need to make sure that your gadgets aren't misbehaving. Especially sometimes in our countries, like Ghana, sometimes the internet is not reliable. Just make sure you test the internet. My friends and I sometimes will have, test calls and we'll check different areas of, wherever you're living, just to make sure that, okay, wherever you are is the best spot for your internet, for your, make sure your gadgets are working, that people can hear you very well. Just make sure that you look presentable as well. You're dressed formally, you're not just dressed casually, like just, meeting a friend. Just try to look professional as much as you can. Another thing I'll say is that when you're preparing for the job, really look at the person's specification and job description for that job. So just go through the job, what they've put as the person that they're looking for, because that will guide the information that you're giving them, because that's the question they're asking. Are you the person you're looking for? You want to prove to them that, yes, I am the person that you're looking for this job. So just make sure if they're asking, oh, we're looking for someone who is able to do A, B, C, D. If you can do A, B, C, D, mention it when you're talking about if they say introduce yourself or tell me some more about yourself, make sure that you highlight those particular skills that they're looking for in your responses. Usually when it comes to the interviews, in my experience, there was usually a clinical part and a non-clinical part. So with the non-clinical part, the questions that you tend to get asked are, talking about your experience, talking about any audits that you've done, talking about any research that you've done. Tell me about a time when you've, been involved in a team, talk about your strengths, talk about your weaknesses. So these are some of the non-clinical, questions that you can expect. And the clinical ones will be based on the particular job that you're interviewing for. So let's say it's an ENT job. You have to read ENT stuff. You have to know what are your best bet usually is emergencies, because they want to make sure that you're a safe doctor. So I would usually recommend whatever specialty that is that you're interviewing for. Know at the very least, if you don't know anything, know the common emergencies and how to manage it in that particular specialty. So you can definitely expect clinical questions as well as non-clinical questions. Do your research as well, ask around. If, sometimes people may have interviewed with that particular trust before for that particular job before. So nowadays there are lots of different groups and things where you can, ask, or has anyone, or sometimes it might not necessarily be that particular trust, but someone may have interviewed for a similar job and they can tell you, this was my experience, this is what I recommend that you focus on. And then just do your research about the particular trust. What are their values? Some of these questions, these are questions that you might ask sometimes. Just find out as much information as you can. Be confident, be clear in your responses, smile, look like you're an approachable person, even if you aren't. But yeah, just be confident as much as you can. Next slide, please. And then I was just going to end my presentation by talking briefly about sort of life in the NHS and my experience so far. So it's coming up to almost 2 years, which is wild because I just feel like I came not too long ago. But for me personally, it was a very steep learning curve. My first job was in ENT, which I'd never worked in before. So my only ENT experience was in medical school. I didn't know a lot, but I think I was in a I had a very, very, very lovely team. And generally, my experience in the NHS, I feel like a lot of the teams I've worked with have been quite supportive. It's not the same for everyone, but I think the the learning curve tends to be really steep when you're not just juggling. For me, I had to juggle, understanding and learning ENT all over again. But even if you know that specialty, let's say you were working in, medicine, you come medicine is different in different places, but there's certain concepts that are the same. Liver cirrhosis, heart failure is heart failure. But I think that, you'd have to learn, whatever electronic medical system that they're using, how do we order investigations, see all those little bits sometimes can be so stressful. And then the NHS is also more complex than usually the health structure in most of the places that we're coming from. Here they have literally so many different roles. There's so many different healthcare workers, and it can be very niche to the point that there's just so much to learn. I remember one thing that I didn't understand was package of care. When I came and they said, oh, as a patient is being discharged, they are medically fit for discharge, they're just waiting for a package of care. I said, what is a package of care? I was like, is it a box? Like in my mind, I thought it was like a box of, I don't know, like, is it biscuits, sweets, things that they need to eat? I was just so lost, only to find out that package of care is basically carers, like coming to the patient's house to help them with, just activities of daily living. And this is something that some patients need to be put in place before they go home. So it's just things like that, just certain abbreviations that you might not be used to, that are not standardized at all, like ATSPs, ask to see patients. It's just like you'll be asking so many different questions. But I think that's what's important, is just ask questions, learn to ask questions, don't be shy. It's better to be safe rather than to look like, oh, I know what I'm doing, and then to, potentially make a mistake that could, lead to untoward consequences for the patient. So just take it one day at a time, work hard. And that's one thing I say is like, if you're someone who works hard, if you're someone who does your job diligently, no matter wherever you find yourself, people will notice and people would also want to help you. It's the same, but at the same time, just make sure that you're not, stressing too much and you're taking care of yourself. Take your annual leave. Book one thing here is book your annual leave well in advance, because if you don't book it and they say they can't find cover, then you're in a tight spot. So find a community, find people around you that can relate to you, find other IMGs in your trust or in other places, and just connect with people. And hopefully the entire journey will be worth it at the end of the day. And yeah, that's about it. I'm done. Thank you so much for listening. And yeah, I'll take any questions now.
I hope everyone joined, learnt a lot. There's actually a lot of people on YouTube. There's almost up to 50 people watching on YouTube. So it's very, very interesting, very helpful. Please put your questions either in the chat box or the Q&A, and Dr. Gloria can answer them. I have a question now from YouTube. Somebody asked, can you get into GP training without getting a job first?
Yes, you can. So, like I shared earlier, when it comes to the job,
Sorry, Gloria, can you turn your camera on? Let's see you.
Oh, is it not on? Sorry.
Okay.
Yeah, so when it comes to the the job opportunities, like I was saying, there's the thing. So the GP job will fall under the training category, which you can get into. Usually when it comes to every specialty in the UK has, their own process of what the application looks like. So for GP training, there's an exam that at the moment, there's an exam that you have to take called the MSRE exam. It just stands for Multiple Specialty Recruitment Assessment Exam. So it's not just GP that uses, there are different other specialties that use it. So basically, this is an exam that you need to take. And depending on your score of the exam and how well you pass, you're allocated a rank, and that rank will determine whether or not you'll be able to get a job. So when it comes to the training jobs and specialty training jobs, there's a website that's different from track. It's called the Oriel website, ORIEL website, and that's where basically every training job application is on. So you can find all of the information and what you need on there. There's usually, if you haven't worked in the UK, so usually you need a document called a CREST form, which at the moment it can be signed by a consultant in your home country as well. So you can also download that online and you'll be able to see what exactly that looks like. But without that CREST form, or without a certificate of completion of foundation training in the UK, you will not be able to apply for specialty training here. So that's one thing that I'll say. But once you've got your CREST form, you fill in the application on Oriel, and they actually longlist you. So they say all of your I think I don't think there's anything that I would have done very differently. I think one thing though is just maybe in terms of specialty training, I think it's just very helpful if even from the get-go, so whilst you are even in Ghana and you're working on your PLAB and things like that, if you know, it depends, not everyone knows exactly what they want to do, but if you know for certain, okay, this is the specialty I want to get into, start looking at what are the criteria that they're looking for. Some specialties are there where there's a self-scoring assessment form and there's points and things that are like internal medicine training. Start looking at those things and start doing those things even right from home, even before you come, because now with non-training jobs becoming a bit more tricky to get into, you just don't want to waste any time at all. So that's one thing that I would say maybe I could have done differently, is just focusing a lot more on what are the competencies that I need to apply for certain specialties that I'm interested in, and working on that from the get-go. Yeah.
Thank you. Someone asked, what about academic clinical fellowship?
So they're very competitive, the first thing I would say. They're very, very competitive because they're not as many as just the purely clinical fellowship jobs, but they do exist. You can apply for them. There's the training ones and there's also the non-training ones as well. So same as all of the other jobs, you need to look at the person specification that they're asking for. Usually when it comes to the jobs, most places, the non-training ones will have essential criteria and desirable criteria. So you want to make sure that you have the essential criteria, and at the same time now more than ever, you want to have the desirable criteria in addition. So if your background and everything that you look at some of these jobs and you fit the criteria that they're looking for, absolutely go for it.
Someone said, with the dwindling job opportunities in the UK, should I still do my PLAB? Very heavy question.
That's a very, very heavy question. So I think I was saying earlier on that, like, I'm a very honest person, and the truth of the matter is that even from my experience, because I've been applying for jobs recently as well, and compared to 2 years ago, there's a vast difference. So I would say at the end of the day, no one can make the decision for you. Unfortunately, we're all different individuals, so we all need to look at our personal circumstances and, because different things work for different people. But I would say that it's definitely a lot, like 10 times more competitive than it was in my experience 2 years ago, even 2 years ago. And it looks like it's only getting worse every single year. So if you haven't started the process at all, definitely really, really think about it, weigh the pros and the cons. What exactly, I think it's helpful to just like write a list of why do I want the UK, or what exactly is it about the UK training that I'm attracted to. And if that's heavy enough for you to, kind of go through the process and manage your expectations and know that, okay, I might not get a job as quickly as, I thought I would, or as quickly as it was a few years ago. But yeah, at the end of the day, it's up to everyone to make that choice. But I will be completely honest and say it is extremely difficult right now. So yeah, take your time and really think carefully before you take any step.
Yeah, I think I can also just add, I think that's very sound advice, because I would also say that the competitiveness is actually happening at all levels. So SHO level, registrar level, even consultant level, depending on what specialty. So definitely, I 100% agree. Take a lot of time to really consider if it's definitely what you want to do. And also, there's a new, I don't know if you will call it a law, but or a new motion that's being
Yeah.
passed where they have to prioritize UK trained doctors for the job post, because there are lots of UK trained doctors who are also not getting jobs. So now the British Medical Association is putting pressure on the institutions to make sure that the UK doctors are prioritized. So I think it is going to be very tricky. So
Absolutely.
yeah, think hard and long before you start that process.
Absolutely.
Yeah. Okay, and then I think this is probably the last question. Have you ever experienced any discrimination being an IMG working in the UK? Been seeing a lot of stuff on Reddit and I don't know what to believe.
To be very honest, so I think context, I work in landing, and I think landing is great as a city, even beyond health. It's a very diverse city. It's very cosmopolitan. There's so many different people from different places. So I think that would skew my experience in the sense that I generally don't experience like outright discrimination. I think there are still definitely a lot of like subliminal, tones, and sometimes people see you and see your color, and then they already have, kind of an idea, or they think that okay, you're not good at your job, or you don't know what you're doing. So there's definitely, the hints and the subtle, looks and stares and things like that. But I haven't experienced any like, oh my god, this person is like being completely racist to me. I haven't had that at all, to be very honest. But yes, there's still, because yeah, there's still, small, comments here and there that sometimes you're like, okay, or certain things that people do, you're like, okay, that's very suspicious. I think you might be racist. But then again, like I said, I'm in London and it's quite diverse here, so it might be different in other places where there's just predominantly more white people, and the experience might be completely different. That might be where they're coming from. Yeah.
Yeah, again, I would agree if I were to add to that. I think the word you're looking for is microaggressions. That's how British people are. It's very micro, small digs. And you know what they're trying to say. I think I've been a doctor for 10 years, but still people are saying, oh, you look too young to be a doctor. And it's like, okay, well, even though I'm the consultant, they're still telling me I'm too young. And sometimes you know what they're really trying to say is, are you sure? Are you sure that you can be my doctor? But I also agree that I've trained in London mostly, so I think we have a much easier experience than many of my colleagues who have trained up north or in less diverse areas. They have experienced overt racism, so it's definitely something that happens. But I wouldn't let that stop you, because people will be racist at any juncture. So I wouldn't let that stop you from doing what you want to do. Okay, so I think that's all the questions. Unless there's any last minute questions, we'll say thank you to Dr. Gloria. Thank you so much for taking time out to teach lots and lots of people, lots of engagement on YouTube. So thank you so much. For everyone, just in case you're not familiar with the House of Medics, we're a community of healthcare professionals based both in the UK and in Ghana. We have a Ghana team as well. We do so many different things. There's lots of things that you can get involved in. So please do sign up to be a member on the website. It's free, and make sure you're on our mailing list so you can keep up to date with everything that we have planned. And we always have lots of things going on, and we should hopefully be in Ghana this December as well. So if any of you are in Ghana and you want to volunteer with us or catch up with us, then drop us an email and let us know. Others will be back next month with another Careers Close Up. Thank you so much, Dr. Gloria, and we'll let you enjoy the rest of your evening.
You too. Bye.
Bye.